Hi, Dr. Adam Goldman here from the Metropolitan Vein and Aesthetic Center. In an earlier video, we talked about acute or sudden onset of a problem in the leg or pain in the leg. And I want to talk to you this time about more chronic problems, how would you know if it's a vein problem? So often the pain will develop slowly and very insidiously, and you say, well, could this be a vein? Could this be some other problem? And there's some ways you can help tell what the problem could be. So the first thing that you want to know is, are there any other findings in the legs? So you may have swelling, you may have varicose veins or visible veins in the leg. Sometimes you may not see any of this and you may still have symptoms. Sometimes also the swelling can get bad enough or happen very slowly, and you may not see the varicose veins because they're sort of covered under the swelling. So that is one problem. So it could be causing other symptoms in the leg besides pain. There could be heaviness. Sometimes there's something called restless leg syndrome, which is a feeling or an urge to move the leg around. And sometimes by tapping it or moving it, you feel more relieved. But all these signs and symptoms can be a problem of venous disease. The other thing that could be causing similar problems is sometimes problems with the artery, sometimes problems with the nerve. So sometimes it's very hard to tell, and sometimes people have all two or three things going on at the same time. So if you're having sort of this slow pain syndrome and you're having discomfort, maybe you feel like the legs that want to move around on their own, or you feel cramps, or you feel pain when you walk, or pain with standing. So there's some things you can do to first try it at home. So one thing you can do is to try elevate the legs. Or if you're standing for a long time, walk around, try and improve the circulation, because as we walk, the muscles contract and push the blood up into the veins. However, the problem with venous disease is that it does not work very well because the valves are not working. So that is not necessarily a good option, but sitting static and sitting down with your legs elevated, it will help drain some of that fluid, some of that pressure, and you should feel better. Same thing you can try also at home is the compression stockings. So they're sold over the counter on Amazon, pharmacies. So generally you want to use a compression of at least 20 to 30 millimeters of compression. There are lighter ones sold in store, but at least a moderate compression is necessary to see if it will help with the symptoms. And if you put these on and then you feel better, it's very likely possibility it's vein disease. So finally, how do the doctors tell? Well, when you come to the doctor, we can do an ultrasound, and we evaluate the vein system, and we provocally test to see if there are leaks or if there is reflux, what we call reflux, when the valve is no longer functioning. And often this can be treated conservatively with compression stockings, with elevating the legs. However, if it's not getting better, there are other treatments that will help and improve your symptoms and your lifestyle and allow you to have a more comfortable, existence. So if you have a question and you're not sure about your legs and you would like to get evaluated, please come see us at any time at the Metropolitan Vein and Aesthetic Center. You can visit us on the web at www.nymetrovein.com. We accept many insurances, and if you don't have insurance, we will do at least a evaluation for free to at least get some idea of what's going on. So please come see us, and we'd love to help you with your vein or leg problems whenever you need to. Thank you.